1,463 individuals have tested positive. Our vaccine rates, as you've seen, have gone well throughout this endeavor. Our total number of first dose vaccines is 59,694, or 47% of our population. Fully vaccinated individuals are 55,694, or 44%. Breaking it down by age group, those 12 years and above account as 53% of our population. 18 and above is 56,000 and 55% of our population. The most number we're looking at considerably is those 65 and older, those we had deemed our most vulnerable population when the vaccination process began. 19,319, or 75% of that population has been vaccinated. Again, we'd like to discuss some changes in the reporting, reasons for that, and discuss a little bit about the new cases we're seeing here in Chautauqua County. At this time, I will turn the microphone over to Christine Schuyler.
Thank you, County Executive Wendell. Good morning. One of the reasons why we wanted to talk with everyone today is to reiterate that the county has reached the level of substantial community transmission of COVID-19, and that comes with some further recommendations from the CDC. The major recommendation there is that people be very conscious that the Delta variant is circulating. It is highly contagious. And while our local labs do not have the resources to do the genetic sequencing, we do know that because of the uptick in cases, the Delta variant is here, and we truly feel that's what has led us to the substantial category of transmission. Because of that, the CDC does recommend indoor masking for both those who are vaccinated and unvaccinated in an attempt to try to reduce the spread of this very contagious Delta variant. To give you a perspective, the original COVID-19 strain that was out, one person could infect 2 other people. Now when you're looking at the Delta variant, one person could infect up to 5 other people. So the Delta strain is very contagious, and we have to just be a little more diligent of what we're doing, especially those who are immunocompromised for any reason, if they have underlying health conditions or are elderly. It's very important that you take extra precautions to protect yourself from this more contagious strain that we are seeing. Vaccination is still your best tool to protect yourself. No vaccine is 100% effective. But what we do know is that vaccinated people are 3 times less likely than unvaccinated people to contract the Delta variant. And that makes it much harder than obviously to spread it to others. COVID vaccines are about 88% effective in preventing severe illness and death from the Delta variant. And more than 90% of all COVID-19 infections, hospitalizations, and deaths are among the unvaccinated. So we look at layers of protection when we're talking about communicable disease prevention. That's why the CDC is recommending to be more diligent with mask wearing when you have a contagious variant such as the Delta variant of COVID-19 circulating, in collaboration with vaccination and continuing good hand washing and respiratory hygiene, staying home when you're sick. I want people to realize we do have some breakthrough cases we've seen, and a breakthrough case is when you have someone who is fully vaccinated, who still tests positive for COVID-19 and is able to spread the virus. And since the data we have as of yesterday, we had 105 cases of COVID-19 since August 1st, and of those, 69% were unvaccinated, 22% were fully vaccinated, and 2 were partially vaccinated. 8 of them had an unknown vaccination status. And those trends really are consistent with what we're seeing across the state and across the nation. That does not mean that the vaccination does not work. What that does mean is, as I said, no vaccination is 100% effective. But we have to use every tool that we have in our toolbox, and vaccination is by far the best tool that we have in our toolbox to prevent hospitalizations and severe illness and death from this continued coronavirus pandemic. I think it's just very important for people to realize we're not going to eradicate the coronavirus. I'm not going to sit here and tell you that our ultimate goal here is to fully do away with this virus. It's not possible. This is a virus and it's here. Viruses are unstable. They can be very nasty. They tend to very easily are able to change, and they can become much more deadly than they had previously been. And that's why the science is ever changing. The research is always going on. And vaccinations, when it comes to viruses such as the influenza virus, the vaccines are updated every year, and that really is based on the most deadly strains of the virus that we're seeing out there. So our goal here is not to completely eradicate the coronavirus. Our goal here is to prevent severe illness and death, not to overwhelm our hospitals, and to do the best that we can to prevent widespread illness and widespread disease out there in our communities. And each and every one of us has a part to play with that. So I ask that you please, if you've not been fully vaccinated, please reconsider your options out there. We're really happy to try to help you answer any questions that you might have about the vaccine, about vaccination. There are some really good, reputable sources out there. I implore you to please know what source you're looking at when you're looking for vaccine information. Talk with your healthcare provider, and continue to be diligent about respiratory hygiene, including mask wearing when appropriate, and hand washing, and taking care of yourself and your loved ones. We're not over this yet. None of us want to go backwards. We need to keep moving forward, and to do that, we've all really got to work really hard together to get through this variant.
Thank you. At this time, we'll go ahead and entertain questions. We'll go through our list of those who have checked in.
Reporting. We have some reporting changes I just also wanted to make the public aware of. I really applaud my staff and all the work that they are continuing to do 7 days a week to get you the best information possible, and also to monitor those we have in isolation and quarantine and vaccinate. We are holding vaccination clinics continually every Tuesday from, I believe it's 4:30 to 6:30 at the Chautauqua Lake School Bus Garage here in Mayville, New York. We are offering right now Pfizer vaccine as well as the Johnson & Johnson vaccine. You can make an appointment or you can just drive through. We have been reporting on a daily basis. We are going to continue to do that Monday through Friday on our dashboard. The change that we're seeing is on the interactive map that's on our website. That really just shows you the total amount of cases that we've had per quadrant. It really, in zip code, it doesn't have the detail of our daily dashboard updates. So that map is now going to be updated monthly instead of daily, but the dashboard will continue to be updated daily. We've also noticed that on the CDC's website, there is a vaccine tracker, and on that you will see our vaccination levels. That data is actually more accurate than what we are able to pull from the New York State immunization information system. That information we're able to pull is really specific to New York State. The CDC's data includes those who are vaccinated at the federal Veterans Administration system, as well as those Chautauqua County residents who are vaccinated in other states. So we will be changing the vaccination data that we're reporting to reflect the CDC data, not just what we're able to get locally. So you may notice a little difference in the numbers in these next few days as we change over to the CDC's data. And I wanted you to understand why that was happening.
All right. At this time, we'll go ahead and answer questions. So we will start. Jeff Graval, WGRZ Channel 2.
Yes, thank you very much. I just wanted to see whether Chautauqua County will have any type of recommendation for indoor mask use, as we have seen in Erie County, which is also in substantial risk of transmission.
We talked about that this morning. Our COVID team just met, and we're going to continue to talk this afternoon. And further information will be coming, but we are looking at the data, we're looking at the information, and we will be working with our employees as we move forward with this.
So no decision has been made?
As of yet, no, no decision has been made.
I think our current decision, as we continue to watch and look at the data that's in front of us and talk with our own county employees, if you're talking specifically about county government, but in general, we are recommending that the public be diligent and have personal accountability and responsibility and wear masking as appropriate in indoor spaces and public spaces.
Anything else?
Let me just ask as well, what is your recommendation to schools that they're, viewing this information? Obviously, there's a lot of preparations that are happening right now for the start school year. Schools in Chautauqua County, are they anticipated to have, full reopening and indoor mask use?
Right now, we are undergoing discussions with our local school leaders, including our BOCES, and we are taking the CDC recommendations as well as the American Academy of Pediatrician recommendations into consideration as we are putting guidance together for our local school districts. We also are awaiting, we were told that the New York State Education Department is issuing guidance for schools. That is to be forthcoming shortly. So we are still in the planning stages with our local schools, being fully aware that the start of school is right around the corner. And we are working quickly and diligently with school leaders to put some plans into place for the upcoming school year.
Anything else?
I know. Was it just to say they're switching over to the CDC website? Right.
Some of us are on, your mics are live, to be aware. We'll move on. Media One, WJTN, Mr. Frank.
Yes, good morning, PJ. Good morning. There was some difficulty at the beginning of the press conference here, and I do apologize for asking you to restate some things. Number one, are we seeing the Delta variant among the newer cases? And PJ, did you give the updated numbers for today?
Yeah, so the question was, are we seeing the Delta variant in the new uptick in cases? I will let Christine answer that. Christine?
Sure. Hi, Terry. Our local labs don't have the capability to do the genetic sequencing that is required to know exactly which variant is seen. So we are assuming that we are seeing the Delta variant here because of the uptick we're seeing in cases. And we know that the state epidemiologist is reporting that 90% of the cases that they are sequencing are the Delta variant. So we feel very confident that the Delta variant is in fact circulating here and responsible for the uptick that we are seeing in cases, sporadic cases, as well as the 22% of cases that were breakthrough cases that we noted.
I gave yesterday's numbers. I could go over those again.
Actually, I think we got those, so I'm pretty well set here. Thanks, Christine. Thanks.
Okay, thank you, Terry. Moving on, Western New York News Now, Justin Gould.
Hey, good morning. So my question would be with the Delta variant. I know the CDC previous guidance is requesting that in high transmission areas, people get back to wearing their masks. For some people in our area, the mask was a hard thing to do in the first place. Before they got vaccinated, a lot of people feeling, okay, I get vaccinated, I should be able to take off my mask. For you, PJ and Christine, what's your message to folks who maybe are a little weary about putting that mask back on now that the Delta variant is spreading here locally?
I have full confidence in the vaccines, but as I said, they're not 100% effective. So there is still a chance that someone with a very contagious variant, as we're seeing with the Delta variant, who is fully vaccinated, can get COVID-19. But in the data is showing that if so, you're not going to get severely ill. The odds of you getting severely ill, being hospitalized or dying are very, very low. But there is a chance that you could still spread that variant to someone who is more immunocompromised. So the more underlying health conditions you have, obesity, diabetes, heart disease, especially chronic lung disease, asthma, it increases your risk of complications, hospitalizations, and severe illness and death from this respiratory pathogen. So those people and the elderly are who we are most concerned with, who need to be extra cautious even when they are fully vaccinated, that they do be more careful with mask wearing, and those of us who are around them have to be more diligent in that as well, to not spread a very contagious variant to them, even if we feel fine but could be carrying the infection.
Again, Justin, my position would be, it's a personal choice, and we need to keep that in mind as we move forward. That personal choice, whether you see somebody in a mask or not, does not make a political statement. That makes nothing more than an understanding, and we have to realize that there are individual differences, and people are entitled to those differences. And that's what I think is most important with this. We know that from mask wearing to vaccination has become highly politicized, and we have to remember to respect the rights of each individual. So these are recommendations we're making, but each person, has a personal choice. It was brought to my attention, if it's raining outside, you take an umbrella. If you choose not to, that's a personal choice. Some could argue either way, but, throughout this entire pandemic, and much to what you just said, there's a lot of concern in the community that, I have been vaccinated, now I have to go back to wearing a mask. We ask everybody, we've never told people you don't have to wear a mask, and I know there are some that are immunocompromised. I've been out, throughout the community. I've seen people wearing masks. I've seen people without masks. So again, it's a personal choice, but we have to respect the choice of others either way, and just keep that in mind as we're out and about in the community.
I try to recommend, some common sense and some good judgment in our actions. And one thing we have seen is that everyone who's been fully vaccinated who has tested positive for COVID-19 has had symptoms. So it goes back to the old adage, if you're not feeling well and you have symptoms, stay home when you're sick and stay away from others, and especially stay away from those who are at higher risk of having any sort of severe disease of any kind.
And then just to follow up on that, the message then to residents would be they should mask up in public places. I know local grocery stores are already starting to require that again. Where would you recommend people to put the mask on?
The recommendation that we're putting is following the CDC's recommendations, and that really is in those public spaces. When you've got more people gathering together, you've got a variety of people, or you're going to be in closer contact with others. So the grocery stores or malls, any kind of these stores, they do have the ability to require masks if they choose to do so. But there again, I'm hoping that people can use some common sense and determine when it's in their best interest to use a mask when you're in a public space where there's a higher chance that some sort of respiratory disease can be spread more quickly. Obviously, anywhere where you're in close contact with others, your chance of a communicable disease increases.
All right, thank you.
Thank you, Justin. Moving on, WRFA.
Thank you. Realizing that the vaccination is now more widely available at doctor's offices and other places, will the county look at increasing, maybe doing more than just the vaccination site as the bus garage to help increase opportunity for people to get the vaccination, since that seems to be a key thing here?
Well, as you said, COVID-19 vaccines are widely available. They're available at just about every pharmacy and also many physician practices. now carry the COVID-19 vaccine or have access to it. We are going to continue to offer our weekly vaccination clinics at this time, and that's really all we are doing. We also, are charged with isolation and quarantine and many other duties that staff have to undertake. So right now, it's within our scope to conduct offer the vaccine once a week at the drive-through clinic, and really encourage everyone to visit their local pharmacies, especially. The vaccine is widely available there for anyone 12 years of age and older.
Thank you.
Thank you.
Anybody else that got on the line late that we didn't account for?
Dave Raleigh at WDLD.
Welcome, Dave, and ask away.
Yeah, just a follow-up question on the schools. I understand there will be a meeting with some of the superintendents later today. Any idea when you hope to have some guidance to local schools?
I don't have a set timeline for you. We're doing the best we can to sort through what's coming, what's out there. Just last week is when the state health department said that they would not be issuing guidance for K through 12 schools. So since then, we've been talking with school leaders and hope to be moving forward based on somewhat of what comes down from the state education department. I'm hoping within the next day or so we'll have something more from the state education department as well, and have have consensus on what we're going to do as a county. I've always been very proud of how well everyone here works together. We work very closely with our schools, and I think we'll be able to do that on this topic as well.
From a personal standpoint, Dave, my position is I think it's imperative the state education department to give guidance and not to, say we'll relinquish this to the local, health departments. We've worked in concert right along with this. So again, I strongly urge, state ed to, issue guidance and help districts along, because again, this is a statewide issue, and as you know, the state ed department does govern, all of our public schools, and it's very difficult to do anything without approval of the state ed. So I would hope that they would, step up and get the guidance to our local districts to help them plan, because as you know, schools will be starting soon. We focus on the in-classroom activity, and my position has been, I'm looking forward to doing what we can to get kids back in school full time. The evidence is out there, the necessity of those individuals on a multitude of levels for our school-age children. But also, prior to that, we're going to have our fall sports teams coming up, and kids are going to be congregating and around one another, and the guidance is necessary, and also for our leaders and school leaders to prepare effectively for the upcoming school year. So I know that they are able to move quickly and on the fly in some cases, but again, I feel imperative that state ed gets that guidance out, and that way, along with state ed and the county, we will be able to help them and guide them, to a reopening plan.
Okay, thank you both. Appreciate it.
Thank you. Is there anybody else on the line? Seeing none, I would like to thank everybody who's in attendance today, and again, follow our updates, and we will keep you posted. But as always, stay healthy and safe, and continue to be CHQ strong. Thank you.